Are you a dental hygienist? I'm looking for a dental hygienist. Hey there, I'm Dr. Brad Miller, Miller Dentistry in League City, Texas. If you're looking for an opportunity, I've got one for you. So when Sandy came to see me and we had taken care of her most immediate problem, which was the abscess tooth, then we looked at the same tooth on the other side. And that tooth had a big old mercury filling in it. And most dentists will say, well, we're going to do a root canal on the crown. I said, wait a minute, let's test it first. Let's see what's going on. And by testing the tooth, I was able to determine the nerve in this tooth is actually just fine. It's healthy. And so we were able to just do only what needed to be done. Old filling out, clean it all up, put a fresh crown on top, a beautiful crown on top, very strong crown on top. And she skipped the root canal on this one. Saved her some money and also saved her having to have her mouth open for that period of time because her jaws get real tight. Don't you hate when you go to the dentist and they say, oh, okay, I'm going to send you somewhere else to get this done? Why would they do that? Probably because they don't know how to do it. I do 95% of my treatment here in my office, whether it's clear aligners or braces, or maybe root canals, implants, treatment for your snoring or your jaw pain. I do it here. I don't send you to someone you don't know yet. You stay with the guy you already know. I have spent years going through advanced training to learn exactly what I need to do to help you in particular specialty type situations. Being a dentist for 33 years, I've had a lot of time to learn this stuff and prove myself. So hey, I'm a perfectionist. That's why I don't like to send my patients out to other specialists. I've got the advanced training. I do it here. I do orthodontics and I do cosmetics and I do all the things that my patients need so you don't have to go anywhere else.
So it's our job to educate them, and that's Dr. Miller's go-to. I mean, that's what he does. He spends plenty of time showing pictures. We take intraoral camera photos of the teeth that are compromised, and so he will actually show it on the big television in front of the patient. So it kind of really makes a connection. His big thing is to make an investment in ourselves. So when people realize we only get one set of teeth and we get one lifetime to either mess them up or really invest in ourselves. And so Dr. Miller loves to educate people. And he's a perfectionist. He worked at the big clinics. Sterilization, it can get kind of sketchy. You know, if you have a bunch of people that are just there for a paycheck, they're not going to show up to work with the integrity to make sure that everything is sterilized, everything is properly wrapped, everything is properly disposed of. That's a big thing, and you don't really think about it. Do you want people in your mouth that you're not 100% certain that everything is 100% clean and sterile? That's a big problem in those big clinics. They're just rip and run and they're herding people in like cattle. And what I have found working for Dr. Miller in this particular private practice office is that, first of all, it's like cheers. Like, we know everybody, we get excited, we'll even step out to give somebody a hug or wave at them, but it's just that really close family. We know your kids, we know your father, we know that you just had an animal get hurt, or that we make notes, we make sure that people feel cared for. I love working for Dr. Miller.